Hey, welcome back to the PTCB Prep Guide. Today, we're getting laser focused on something super important for your exam: blood and immune system drugs. We're going to cover the high-yield names you absolutely have to know. I'll break everything down in a really simple, visual way, connecting the dots between the conditions and the exact meds you'll be handling in the pharmacy. So, are you feeling totally overwhelmed by all the different blood disorder drugs? You know, the anticoagulants, the antiplatelets, all those colony-stimulating factors. It's a lot, I know. But don't you worry, we're going to cut right through all that noise and focus only on what you'll actually see on the exam. This is your clear path to getting this stuff down. Let's dive in. Okay, here's our game plan for today. We're going to tackle this by looking at three main problems: the oxygen problem, which is anemia, the infection problem with white blood cells, and the clotting problem with platelets. After that, we'll pull it all together with a big review and then a super fast memory drill to make sure it all sticks. All right, first up, section 1, the oxygen problem. We're talking about anemia. So what happens when your body just can't get enough oxygen delivered? Let's look at the drugs that fix this. Okay, so what exactly is anemia? At its core, it's just an oxygen delivery problem. Think of your red blood cells as little taxi cabs for oxygen. If you don't have enough cabs or they're not working right, your body's tissues just don't get the oxygen they need. And that's why people feel so tired and weak. Simple as that. So this chart breaks it down perfectly. You see the problem, we give the solution. If someone's just low on iron, that's easy. We give them ferrous sulfate. If they have that macrocytic or large cell anemia, we figure out what they're missing. Is it B12? Then we give cyanocobalamin. Is it folate? Then it's folic acid. Now, for anemia that's linked to chronic kidney disease, we bring out the big guns. Drugs like Epoetin Alfa, that's Epogen or Procrit, and the longer-lasting version, Darbepoetin Alfa, brand name Arenisp. So you might be wondering, how do those last two drugs actually work? Well, your body already has a natural system for this. Your kidneys release a hormone called erythropoietin. We just call it EPO. And that hormone is like a message sent to your bone marrow saying, hey, make more red blood cells. So drugs like Epoetin Alfa, they're basically just a man-made version of that exact same message. Okay, let's move on to our second big problem: infections and our white blood cells. This is all about the immune system. We're going to look at what happens when our body's defense squad is either weak or just not working right, and the key drugs we use to get it back in shape. For the exam, you can really think of white blood cell disorders in two main buckets. In the first bucket, you've got cancers like leukemia and lymphoma. Here, the defense system is, well, it's corrupted. It's making a bunch of abnormal cells. In the second bucket, you have neutropenia. This is where the defense system is just weak. There aren't enough of a specific type of white blood cell called neutrophils, and that leaves the person wide open to infections. Okay, this right here is a classic PTCB flashcard fact. Seriously, write this one down. If you see a question about how to tell different lymphomas apart, the one thing that points directly to Hodgkin's lymphoma is the presence of a specific cell, the Reed-Sternberg cell. That's your key. Memorize it. So what do we do about that neutropenia, that low white blood cell count, especially when it's caused by something like chemo? Well, we use these awesome booster drugs. The first one is Filgrastim, which you'll know as Neupogen. It's a GCSF, which is just a fancy way of saying it sends a signal to the bone marrow to crank out more neutrophils. And then there's Pegfilgrastim, or Neulasta, which is basically the same thing, but it's long-acting, so it keeps working for a while. Hey, just wanted to jump in and say you're doing an awesome job sticking with this. If you're finding this helpful, do me a quick favor and hit that subscribe button. It really helps us make more of these PTCB prep videos for you. Thanks a bunch. All right, let's get into our final big problem area: clotting and platelets. Now this one is really a two-sided coin. On one side, you have the danger of bleeding too much, and on the other, the danger of clotting too much. It's all about balance. And this slide shows you those two extremes perfectly. Look on the left. The problem is bleeding too much. This is where you see conditions like hemophilia, where a person is literally missing the factors they need to form a clot. Now look on the right. The problem is clotting too much. This is where you get those dangerous, unwanted clots that lead to things like a DVT, a pulmonary embolism, or even a stroke. Okay, listen up, because this is a super important safety warning for every pharmacy tech. Heparin, which we use all the time to prevent clots, can have a really scary and backwards side effect. It can cause something called heparin-induced thrombocytopenia, or HIT. And what that means is a massive, dangerous drop in platelets. This is a huge deal, a true high-alert situation in any pharmacy or hospital. Now, for your exam, and just for real life in the pharmacy, you are going to see way more drugs designed to stop clots from forming. So that's what we're going to focus on right now, the meds that solve the problem of clotting too much. And here they are, the heavy hitters. These are your anticoagulants. People call them blood thinners, but that's not quite right. They don't actually make your blood thinner. They mess with a chemical reaction that forms a clot. You've got the old school classic, Warfarin, brand name Coumadin. You've got injectable heparin. Then there's enoxaparin or Lovenox, which is a special type called a low molecular weight heparin. And then you have the newer pills, the DOACs, like rivaroxaban, which is Xarelto. Now, this is super important. You have to know the difference between anticoagulants and antiplatelets. We just saw that anticoagulants work on that whole clotting cascade. Antiplatelets, on the other hand, are different. They work on the platelets themselves to stop them from getting all sticky and clumping up. The one you'll see all the time is clopidogrel, brand name Plavix. And then there are super powerful ones like Eptified or Integralin that are used for serious heart procedures. Phew, okay, that was a lot of info, right? So let's pull everything we just learned together onto one single slide. This is going to be your ultimate cheat sheet for this whole topic. All right, here we go. To fix the clotting problem, remember Warfarin, Coumadin, heparin, and the antiplatelet clopidogrel, Plavix. To fix the oxygen problem, we have Darbepoetin Alfa, Aranus to boost those red blood cells. And to fix the infection problem, we use Filgrastim Epoetin to boost the white blood cells. Honestly, if you can nail these 5 drugs, you are in fantastic shape for the exam. Okay, you ready for a quick hitter review? We're going to do a rapid-fire drill right now to lock these facts in for good. Just the key connections. Let's do it. EPO stimulates red blood cell production. Got it. GCSF stimulates neutrophil production. Reed-Sternberg cell equals Hodgkin's lymphoma. No exceptions. And maybe the most common one you'll see, Warfarin, is Coumadin. Lock it in. And that's a wrap on our deep dive. You just broke down 3 really complex topics, and most importantly, you connected them to the absolute key drugs you need to know. You did an amazing job today. Seriously. Knowing your drugs like this is the #1 key to passing the PTCB. You're building that real-world pharmacy confidence right now. If this helped you, please make sure you subscribe and like the video so we can help more students just like you. I'll see you in the next one.